Greetings, everyone. Today, I want to welcome Dr. Donnie Beth Davis to the Mom Chief of Everything podcast. Dr. Donnie Beth Davis is a family chiropractor who owns Sozo Chiropractic in Kenosha, Wisconsin. Thank you so much for joining us today, Dr. Davis. Can you get us started today by sharing a bit about yourself and why you're so passionate about what you do?
Sure. Thank you so much for having me. I love every opportunity that I can get to talk about what I do and how chiropractic can help families. And just a little background about myself. I was raised with chiropractic. I'm actually a third generation chiropractor. So I've been under care myself my entire life. And when I graduated high school and began undergrad, I actually was headed down the path to become an elementary education teacher and began working part-time at my dad's office and just realized the value of chiropractic care and realized what I grew up with was pretty unique and wanted to have that for my future family, but also wanted to be able to offer that to other families as well. So I switched my major and ended up going down the pre-chiropractic route for undergrad and then went on to chiropractic school. And while I was in school, I was actually already married and became a mom. And was able to start living out that dream of providing care to my children and to my son under the guidance of a clinic staff doctor, and then have continued taking care of other families and continue taking care of my own as my family has grown. And it's just, the results are pretty incredible, and I just really love to be able to serve and help families.
Awesome. Well, for our audience, many of my listeners may be familiar with chiropractic, but some people might not. Can you chat a little bit about what exactly chiropractic is and then how it benefits the body and overall health?
Yes, I think it might be helpful if I can just give a little bit of anatomy information to help explain what we do. We have our spinal column. I think we're all familiar with that part of our body. And then traveling through the spine is our components of our nervous system. And those nerves are branching out in between each vertebrae. And as we go throughout life and move and twist, lift, bend, all those things, those vertebrae can shift and be misaligned. And when that happens, it can create irritation on the nerve at that level, which will then impact the function of it and how well things are communicated from the brain to the rest of the body, and also from the body back up to the rest of the brain. I do have a model here with me that might help illustrate that. I think you should see that. So part of the spine here, so you can see these little yellow pieces. You see that okay? That is showing the nerves that branch off. So you can see how there's, it easily can be affected by the positioning of the vertebrae, and then also the amount of movement and then inflammation that can come to that area. So what a chiropractor does is evaluates those joints, finding areas of what we call subluxation, which is areas of where it's not moving well or it's not lining up quite right. And we do a very gentle and safe correction called an adjustment to that area in order to help improve the function of the joint, which therefore helps improve the nervous system and therefore then affecting the rest of the body in the way that it functions.
That is a great explanation. And for anyone listening who didn't get to see the model, you can actually go to my YouTube channel and actually watch this podcast, and you'll be able to see that spine model that Dr. Davis was talking about. Now, when people come and see you for chiropractic care, what are some of the main reasons that they come to see a chiropractor, or specifically, what do you tend to see more?
Sure. So definitely a majority of people, it's pain. Pain is the reason that motivates them to begin chiropractic care. But as education is improving and people are becoming more aware of the benefits for babies and kids, they aren't necessarily complaining about pain. They're coming in for colic type symptoms, digestive issues, sleep issues, chronic ear infections. I would say those are probably the more common things that we see kids coming in for initially.
That's great. I guess I didn't realize, I could have benefited, my kids could have benefited if they had chronic ear infections. What are some of the things that you do? Because I know that chiropractors can treat all ages,
Mm-hmm.
and you specifically really focus on the family, and the
Yeah.
family has all ages.
Mm-hmm.
Some people may be concerned about, yeah, the pop and the snap,
Yeah.
that often people associate a chiropractor with, which
Yeah.
may or may not be true. Can you kind of talk about that, and then how um, you would treat a child with chronic ear infections?
Sure. Well, one thing I'll say too is that we have ways of doing the adjustment where there isn't that popping or that noise. We have some people who come in and they are just terrified of that noise and they do not want to hear that.
Mhm.
And so we do have some techniques that will still allow for an effective adjustment, but it's doesn't include that noise. If that happens, we explain that to them as well, and that all that's happening is there's gas that's built up in the joint capsule. And when you get movement in the joint, then that gas releases, and that's all that noise is.
Mhm.
And then the way that we adjust kids is very different from what we would do with an adult. Their muscle tone is not the same as someone who's older, who's done years of training or whatever their circumstances might be. So the amount of pressure that we use is very light. We evaluate the whole spine, but oftentimes if it's chronic ear infections, we are going to see areas of subluxation in the upper cervical area, so the upper area of the neck, and that can then affect how the eustachian tube is functioning, and then again that nervous system affecting the immune system, and how effective your immune system is able to work and fight off infection.
Wow, that is fascinating. So I learned something today, and I appreciate
Yeah.
that. Now, I've had chiropractic. I've had a long time ago, 2004. I had a roller coaster injury, and without the help of a chiropractor, physical therapist, and a massage therapist, I would probably still be dragging my leg as I was trying to treat
Mm-hmm.
patients. And one of the concerns that, having not had chiropractic before that, was I was concerned that I would be in more pain after an adjustment, because I
Mm-hmm.
had only heard of what chiropractic was. Can you
Yeah.
talk a little bit about what people could expect on the first time that they come? Is an adjustment painful, and they may or may not, like you said before, hear the pop or the
Mm-hmm.
sound?
Yeah, so what we typically do on our first visit is we take that opportunity to gather information. So that first visit is a chance for us to find out the history of each individual circumstance, and then do an evaluation, and then decide at that point on whether or not we need to order any follow-up x-rays or MRIs or anything like that. And then we will plan a follow-up appointment, which we call a report of findings. And then that gives the doctor an opportunity to review all the information we gathered on that first visit and put together a plan of recommendation. And then that next visit is when we would go through that, give some information about what we do and how we do that, and then do that first adjustment. We have a variety of ways of doing that. We take into consideration age, the situation that's going on, the amount of inflammation that's there, a lot of different things that we take into consideration to make it as comfortable and as effective as possible. But I've had even some patients who deal with fibromyalgia. And if you've ever, worked with anybody who's had that, or if people that are listening, if you have that, you know that just about any kind of touch can be painful. So we have, again, very light adjusting techniques that are tolerable. And also, again, we want it to still be effective, and we are still able to see results even with some very, very light adjustments. There can be times when we are doing, as we just are palpating areas, a spot might be kind of tender, but that's not so much because of what we're doing. It's more so because of the dysfunction that's at the joint there. And we are going to work towards minimizing that. And again, as comfortably as possible. So, if someone were to ask, does it hurt to be adjusted? I would say generally no. And we are going to work with you to make it comfortable and put them at ease as much as possible.
Excellent. I know that one of the skills that sets you apart from many other chiropractors is that you have the ability to do the Webster technique. And for those who aren't familiar with what the Webster technique is, can you explain that and share a little bit more information about that?
Yes. So both myself and Dr. Panita, the other chiropractor here at Sozo Chiropractic, we are both certified in the Webster technique, and that is a specific method of evaluating the pelvis. And it can be done for anybody, but we primarily do this with women during pregnancy. And as women, we're aware the pelvis is what forms that birth canal. And so it's a very important area to have examined and evaluated during pregnancy, not only to help make sure mom is as comfortable as possible, but also to help baby move into the best position that is going to be the best for their development, and has also shown to help improve labor and delivery, adding some ease to that, reducing labor and delivery time, and again, making sure baby's in optimal position for delivery. So it doesn't look a whole lot different than what we do with other people who are not pregnant, but we are adding in some evaluation of the soft tissue, such as the round ligament and the psoas muscle, also taking a look at the front of the pelvis where the two halves come together, forming the pubic symphysis.
Okay. And so the optimal positioning for the baby is for the baby to be delivered head first.
Correct.
And many listeners may identify if a woman has a breech baby, the feet are first.
Correct.
And that makes it a lot tougher for both mom and baby. So what you're saying is that there are chiropractic, are they adjustments, or is it a technique that allows the baby to move so that they won't be breech anymore, or
right,
the head will be delivered first?
Yep. So what an ideal situation would be is to work with mom all the way throughout pregnancy. And we are evaluating that throughout. And every case that I've had, baby is head down at that point in time that baby needs to be head down. If we're able to work with mom through the whole pregnancy, we usually ask them to have their birth care provider, whether they're working with a midwife or an OB, to verify that baby is head down at 30 weeks. This is a lot earlier than what the birth care providers are going to be probably checking for because of, determining the birth plan. But we like to check early to be able to make sure we have plenty of time to get baby into that good position. And then also it's less strain on the baby's spine if they are head down at 30 weeks. So it's also going to help support baby's development, spinal development as well. And was there another question that you had to that I can't remember?
No, actually you answered them both, sharing more about the technique and then how it influences both mom and baby. I think that's fascinating because there's probably many women out there who didn't know what to do when their OB said, oh, we're concerned because the baby isn't turning.
Right.
And this is a great option. So
yes, it's extremely safe and extremely comfortable. Now, some
Great.
Birth providers will offer the option to do what's called an external version, and where they can try to manually move baby into a position, and that can be helpful if you want to avoid a C-section, but yet it's not a comfortable procedure to have done. And so if chiropractic can help you avoid even that, I think that's a huge success. And also to try to avoid the intervention of a C-section as much as possible. And so that's something that we love to help moms with, and love to hear successful and smooth birth stories that follow.
Right. Well, and I think the key that you said before was that every mom that you were able to work with had a delivery with the baby head first.
Mm-hmm.
And that is a huge confidence booster for a worried mom coming in to
Yeah.
see you, that they can come
Mm-hmm.
in with confidence and be relaxed, knowing that what you are going to tell them and what you're going to do is 100% effective with everyone
Yeah.
that you've seen. So
Mm-hmm.
that's awesome. Now, I've heard um, some moms and also some of my colleagues in physical therapy be nervous about chiropractic care for infants, toddlers, and young children. And based on what
Mm-hmm.
you've said already, it doesn't seem like that really is any type of concern, that it's kind of like a myth. What are
Mm-hmm.
some of the concerns that you hear, and what information can you share to help people overcome their concerns about that?
Yeah, I think a lot of those concerns come from misinformation and misunderstanding about what we do. There's a lot of crazy videos out there of people who are chiropractors or who claim to be chiropractors doing some manual manipulations that look like torture. And people are concerned that that's what we're going to do to their little child or their infant, and it looks extremely different from that. And so we just talk through, what an adjustment looks like, and the safety ratings on it are extremely, extremely high. And we also give kind of an analogy to test or to explain the amount of pressure that we use, especially for a newborn baby. The pressure that we use is similar that you would use to test the ripeness of a tomato. So I think giving that kind of an example helps people to be aware of that it is very, very light, but there is some pressure involved, but done in the right place in the right direction can be life-changing with results. And that's the other thing too, is just really explaining the type of outcomes that we would expect to see. I think also helps to put parents at ease, especially if they're in a situation where they've exhausted all their other options, and they don't know what else to do. I really love being able to say this is a safe and effective thing that we can definitely try, and we see some really amazing results.
Excellent. I know that many of my patients in physical therapy also have received chiropractic care. And sometimes when they start physical therapy, one of the first questions to me is, do I have to stop my chiropractic treatments?
Mm,
And I wanted to make sure that we talked about this, because it's an absolute false belief that you have to choose one or the other.
mhm,
And as a physical therapist, and as I mentioned before about my own injury, I really like to coordinate my care with other people, especially if they've been treated with chiropractic before and are kind of on an ongoing program.
mhm,
Um, like I mentioned before, in my roller coaster injury, I had severe whiplash and probably had a concussion, but it wasn't so in the forefront like it is now.
mhm, yeah,
And when that started to resolve, I realized that I was dragging my leg, and my pelvis, my back, everything on my spine, not just my neck, had been impacted from
mhm,
this roller coaster. And it wasn't anything that was wrong with the roller coaster. I wasn't fitted into the seat very well, and I just
uh-huh,
had that bar, and I felt like I was coming out of the ride, the entire ride. So I was coming up and then kind of slamming back down into the seat, and then I'm holding my head because I'm fearing that I'm going to fall out.
Yeah.
And so when I got off of that, I felt just like really off, and then, you know, the vomiting started and stuff because of the concussion from the whiplash. But if it hadn't been for coordinated care of a physical therapist who actually sent me to the chiropractor next door was working in, because she just couldn't get me unstuck. I was so rigid and guarded. And the combination of the PT, the chiropractic, and then the massage was just, you know, 4 months of therapy, and that collaborative approach was so helpful. And so when patients come to me, I want them to have kind of a similar experience. And I know that we kind of share a similar philosophy in that. Can you kind of describe how you coordinate services with, maybe it's not just physical therapy, maybe it's massage therapy, acupuncture, whatever it might be. How do you incorporate other services, and when do you find that to be beneficial for patients of yours?
Yeah, I look at every patient care as a team approach, in that first and foremost, the patient is part of the team in determining what we're going to do. And so it's listening to them and what they're seeking and what their goals are that will determine if how much chiropractic is going to play into that, and who else do we need to get involved to help them accomplish those goals. And then I also take into consideration what I would anticipate the results to be. And if I'm not seeing those results that I would expect, let's say, you know, I would expect for a patient to be 60 to 80% improved within 2 weeks, and we get 2 weeks later and there's little to no improvement, or even below that, we're going to start having that conversation, most likely for physical therapy to be the next component to involve with that. But I love taking a team approach. I feel like it makes my job easier because I can focus on the things that I can do to help. And then we get other people involved, like physical therapists. And again, for those tricky cases where it's not responding, most of the time, once we get physical therapy involved, then we start to see those results that we want. And when I look at that, I think everybody wins. And you know, we're here to just serve the patients, and I love to network and refer and work with other providers that have that same viewpoint and really strive to offer quality care. And just, you know, working within those network of people. And again, it's the patient's level of commitment too, of where they're at and what they're willing and wanting to do to get the results, and how quickly they want to do that.
Right, exactly. And that is such a key point, is making sure the patient is part of that team. Because, you know, I have patients who come in and they say, I don't want to complain. And I'm like, if you don't complain, I can't help you.
Right. Yes. I say the same thing.
And it's so
what we're here for.
Exactly. And it's so important, I think, for our listeners today to know, whether it's them or whether it's a family member, whether it's a friend, that they feel comfortable helping us help them make the best decisions.
Yeah.
This has been really, really great. And I want to make sure that people can have the opportunity to learn more about you and your practice. How can they find out more about what you are doing, what opportunities you may have available for them to connect with you? Feel free to go ahead and just share some of that information so they can touch base with you if they'd like to.
Sure. Yeah. So our office is located in Kenosha, Wisconsin. We do have a website, which is sozochiropractic.com. And we are also on social media on Facebook and Instagram. And so we try to keep up-to-date information about events we have going on, and classes that we have that we're offering. The next event that we have is an open house. We just recently moved to a new location. Our practice has been open for almost 6 years, but in November of 2019, so just a few months ago, we moved to a new location. So we are having an open house, and that will be Friday, February 21st from 4:30 to 7:30. And we strive to make our practice as family friendly as possible. So we're going to do the same thing for our open house and have activities for the kids to do, and an opportunity for the whole family to come and meet us and see where we're at, see our office, and find out a little bit more about what we can do. We will be offering posture screenings at the open house. So if it's something that you are thinking maybe chiropractic might be helpful for you or your child or anyone in your family, there will be an opportunity to get some more information about that. And then a few other things that we have coming up down the road is it's called Planning a Positive Pregnancy. And we've started offering that class. And really, it's for anybody who's thinking that maybe they want to become a mom. They may not yet be a mom. And so starting to plan out what pregnancy would look like, or it's also great information for someone who may have not had a great pregnancy the first time around, or not a great labor and delivery. It can offer some information on how to plan to make that a more positive experience the next time around. And so that will be in April. We're working on getting those exact dates set. And then in May, we will also be having a Mom's Night Out event. And so this is a yearly thing that we do, and it's a really fun night, a chance to connect with other moms of all ages and moms in all seasons of life. We will have some educational information as well as a variety of vendors. We try to be selective and just bring in people who will be resources and helpful for help improving the overall health of your family. And so that will be the 29th of May, I believe. It's a Friday evening.
Excellent. You have a lot of great events for the entire family, as well as moms to be. And I think that is just excellent for this community. This has been great. I've learned a few things myself about chiropractic today. Mm-hmm. And I think it's been great to dispel some myths about chiropractic for moms and families who have been maybe a little leery to have infants, toddlers, children try chiropractic. But I also think it's been just such a great resource for moms who are pregnant, and they know about the Webster technique. Mm-hmm. They also know about how you are able to have some success with some chronic kid issues like the ear infections. Yeah. And I really liked too how you were able to describe how you can adjust the pressure, because not just for kids, but also for people with medical conditions like fibromyalgia, but they're just really, really tender and nervous about being touched. So I love that. And that analogy of the pressure can be as light as checking the ripeness of the tomato. Yeah. I think people really understand that. And I think that's fabulous. Is there anything else that you would like to share in our last couple minutes here?
Just thank you so much for giving me an opportunity to share that information. I think that the more we can inform people about the safety and kind of put at ease those concerns, it's going to really help improve everybody's health. And our motto at Sozo Chiropractic is that we are striving to change the health of our community one family at a time. And it's opportunities like this that really give us a chance to really do that. And so thank you for having me and being a great resource for our community.
You are so very, very welcome, and I appreciate you coming on today. Until next time, be bold, be beautiful, and be you.